We're going to be doing a treatment of the levator scapula. So the first thing that we're going to be doing is doing a little palpation, anatomy review, and then accessing into where approximately it is. And then just a couple techniques that I use when I'm treating this levator and the posterior kind of lateral neck. First thing I'm going to do is try to landmark some of the attachments on the cervical spine. So I'm identifying where her mastoid process is here of the temporal bone. I'm going to roll anterior off of it and sink in. I'm going to bring her head back to neutral just to orient myself. Yep, so right in this area here is our transverse process of cervical vertebra 1, which is the beginning of the attachments for levator scapula. And then going a little bit lower down, we have 2, and then we have 3 and 4. So the posterior tubercles on the transverse process of cervical 1 to 4. So if you're finding the TVPs, you're hooking a little bit more onto the posterior aspect. And I'm just doing an anterior posterior strum. Now this muscle already feels quite tight on this individual. So this will hopefully kind of make for a nice ropey muscle that you'll be able to see, but we'll find out. As I am kind of traveling down the posterior aspect of the neck, levator is going to get a little bit more muscle belly, less tendinous. So right in here, you probably should be able to see me kind of flicking back and forth. It's going to get bigger. And this is a little bit easier of a belly roll to kind of follow along. Hopefully I'm not causing too much discomfort as I'm doing this. As I follow this down, the muscle twists on itself. So this is usually the location where you can see the best kind of muscular roll. If you are palpating on yourself for fun, we're going to be in a kind of this neck triangle area here. So what I want you to be is lateral or beside the neck. Obviously we're behind the clavicle, and then you're going to go in front of your trapezius. So towards this posterior kind of corner of it, if you sink your finger back and forth, you often will feel a really ropey muscle. And its insertion is into the superior aspect of this scapula. So I can feel her superior angle of the scapula quite easily without putting a lot of pressure into it. It's right here. But on some individuals, and depending on how their scapulas are sitting, it might not be this easy. So alternative way is to try to draw it up. So you'd reach underneath, cup the scapula, and lift it up towards you. So I'm going to do that right now. Just to kind of show you. I'm going to reach across with my other hand. I'm going to roll her shoulder forward. You don't want your person to help you out a whole lot because they're going to contract a lot of muscle tissue. So I'm just going to peel her scapula back. My fingertips are actually grabbing onto her inferior angle right here. So if you look towards the top of the shoulder for me, you're going to notice that as I pull on this, it's actually starting to move the scapula up with just my fingertip pressure. So that's what I want to see by grabbing on with your fingertips. You're going to draw the scapula into elevation like so. So I'm going to put this back with my hand underneath it, and then I'm going to go into that same triangle where I was, and I have my fingertip now placed on that superior angle, and from below I'm doing that same motion, and I can easily feel her superior angle pushing up into my hand. Now, depending on your text reference source or what you've used as the insertion of levator, some people will say it starts to insert right at the top and then starts to go down the medial border. So this is the superior part of that angle, and this is the superior medial border. So as you draw the scapula up, you'll be able to access this a little bit. Again, it just depends on how tight it is on your partner that you're working on, or your body, I should say. So in this instance right in here, I'm going to place my finger running down along the muscle and then into that superior aspect, and I'm going to get her just to try to raise her scapula up. Great, just like so. We're going to point out kind of 2 motions that when people raise a scapula up. Now, she already knows exactly the action that I was hoping for, but some people, when you do that, are going to raise that acromion up, which is more of a trapezius elevation. So it's trying to bring this acromion towards the ear, so you get an upward rotation elevation with it. But what I'm asking is for her to raise this part, so the scapula goes almost straight up and pinches in a little bit. So that's elevation with a downward rotation. So as she elevates and kind of pushes, great. This acromion isn't swinging closer towards the ear. It's more the whole scapula is lifting straight up. So that is the action of levator scapula. So now that we've kind of identified where the muscle tissue is, again, I'm just going to cross fiber it. We got some ropiness into it, so that's going to be part of what I'm going to be trying to do with a little mini treatment here. So I'm going to bring this to the side without putting a lot of oil or lotion on. One of the things that I like to do is to try to create a little bit of space for it by peeling off some of the superficial muscles. So into the back here, I'm going to try to peel back upper trapezius as well as splenius capitis and some of the other superficial muscles. So I'm going to try to pinch and pull them back, pinch and pull them back, and try to pull, create a little space, loosen it up a little bit. Another option is for you to reach underneath and you can peel from the bottom. So again, grabbing with your fingertips and pulling back, trying to create a little bit more space for this levator. So again, once we've opened this up fascially, you can push down on trapezius, and I'm going to start to lift up the head and pull it away. So again, down on trapezius, lift up and peel away. Trying to get it move a little bit away from that scapula for me, like so. And I'm going to go right on the top of the scapula and do a similar thing. So I'm getting a little bit of that posterior and middle scalene, plus I'm trying to push down trapezius. So I've done a little bit more what I would call kind of fascial work, and now I'm going to add a little bit of lubrication to my hand here. I'm going to turn her head to the side and just do some generic effleurage kind of strokes. So we'll go down over top of superficial muscles. And then I'm going to get into some stroking techniques. I might use, again, a very light knuckle stroke and kind of go up along trapezius into the posterior aspect of the neck. Again, I'm not pushing with a lot of force here, just doing more of a broad stroke. So this could be one way to utilize it. The other way, again, if we bring the head back a little bit towards neutral, pull it out, I might go inferior down instead of peeling up. So again, putting my flat of my knuckles across the neck, kind of pushing in. I'm leaning. You can see my wrist is fairly stable when I'm doing this maneuver, and I'm using my upper body to turn and twist. Please do not get into the habit of just doing this type of a movement. Otherwise, oftentimes you'll get some clicking and cracking, which you might hear in my own wrist as I'm doing this. Loosen it up a little bit. We're going to peel trapezius a little bit more, that I have a little bit of a muscular techniques. I might try doing some picking up, decrease its tone a little bit, go all the way along. We might have to see how tight levator scapula is in comparison to sternocleidomastoid. So again, I might need to peel SCM up off because it's crossing over some of the highest levator attachments. We want to feel the middle scalene, see how tight it is. So I'm just going to do some strokes down along the transverse processes in her neck. I'm feeling quite a considerable roll right in this area here. It should be easy to pick up on camera. So I'm going to follow that one and see where that's headed. And this is heading into towards the posterior aspect of the neck. So this could be something more like splenius cervicis, or even longissimus cervicis, or one of those posterior neck muscles, instead of our levator, which is going into this location here. Do a little bit of a thumb stroke down and along. Again, I'm using a slight lengthening as I do this. I'm running down along the muscle tissue. It is an ipsilateral rotator, so as I run along levator, I'm laterally flexing and contralaterally rotating her head away. So I'm getting a little bit of a lengthening with it. And we can do the same thing on the attachment. So if I can pin my fingertips or my thumb on that attachment. I'm just going to slowly move her head a little bit away. Now, since I have quite a bit of pressure down, I just want to make sure that she's comfortable with this pressure. I'm not getting too high on a pain scale. And I'm going to take my time and just take up a little bit of slack as I go, because I don't want to be more of a forceful technique. I want to give it a chance to release a little bit. And then a move that I like to do in practice, because it is kind of bringing the head back into extension as well as ipsilateral rotating, elevating. I'm going to put my forearm underneath and I'm going to roll her head away. So now I have her inflection, lateral flexion, and contralateral rotation. And I'm going to go again back on to that scapula, hold the scapula down as I will simply roll her head using my forearm and push it as if she was trying to smell her own armpit in this case. Good. So we're getting a nice pin and a lengthening and a stretch here. So if you, again, your fingertips are getting a little bit tired, you can try to hold the scapula down with your thumb or even kind of palm that area. So I'm going to hold and lengthen by holding down that scapular complex. I just typically find this is a little bit more generic than if I can actually put a digit right on the actual superior angle and pin and then lengthen. So I'm going to hang out here for a little bit and just see if she can take some nice deep breaths and make sure she's breathing through this in case this gets higher on the pain scale for her. Are you comfortable with my pressure and where we're at? Mm-hmm. Any numbness or tingling running down into your arm at all? Mm-hmm. Okay. Good. And now we're going to bring the head back. So I'm just going to transition, pull my forearm out. And because this is attached to the scapula, I do like to move a scapula around a little bit. So I'm going to be reaching underneath, very similar to when I accessed it. I'm going to grab that inferior angle. And this time I'm going to use two hands more on the scapula. So I'm going to raise it up and then lower it back down, and raise it up and lower back down. And it's going to be hard, so I'll describe it, but with my bottom fingers, I'm going to try to find the inner edge of the scapula, medial border, and then with my thumb, I'm going to pinch in through the front. So I'm trying to essentially almost grasp levator as it's getting close to its insertion. So medial border with these fingers and thumb squishing from the top here as I've lifted it up, and then I'm just going to release it and go back and forth and see if I can get almost a little pinch or grasp on it. Again, just be careful about your thumb pressure if anything starts to compress nerves or arteries in this area. And then again, let's just feel how that superior medial border is through trapezius and those rhomboids. Draw a little bit up along the rhomboids using our body weight as pressure. I'm going to go into that superior medial border. So for some people, they might feel a little bit more of a levator referral from this, but I'm just going to sink in and let our body weight utilize the pressure. So again, placing my fingertips medial to the scapula, and then I'm going to draw them up along that medial border. I'm past the root of the spine, and I'm getting into more of that superior medial border as we work our way all the way up towards the superior angle. I'm going to release my pressure there. Okay, just a little bit of a clearing flow from that side, just because we've been working quite a bit on the side of the neck there. Some strokes up along the neck, and then I'm going to rotate her head and do some clearing strokes down from the neck. After doing some levator scapula work, I want to make sure I've reactivated it a little bit, just because we've released it and it often holds a lot of tension. So I'm just going to be asking her to try and, again, bring that shoulder up and back down. Is there any pain when you're doing that initial squeeze at all? No? Okay, let's do it a couple more times. Let's do it one last time. Excellent. And let's just finish with just a couple strokes up along the lateral neck and towards the head, and a little bit of a traction to again try to elongate some of those cervical bones a little bit. So I'm just going to reach underneath, run my fingers up till I get to that mastoid process, and just to sustain a gentle lift or traction. And that's going to conclude our levator scapula treatment today.